You know that feeling? One moment you're standing, and the next, the world just goes dark. Fainting. It's usually harmless, right? But what if it's not? What if it's the very first and maybe the only warning sign of a serious heart condition? Well, today, we're going to crack this medical mystery. We're looking at how doctors use a simple, classic tool to figure out in just minutes who is in real danger. So let's put you in the moment. You've just fainted. You're in the ER. Things are moving fast. Before they do anything else, what's the one test they're going to run to figure out if this is a minor blip or a major emergency? Any guesses? Let's find out.
Okay, so first, the official term. It's called syncope. It's just a fancy word for fainting. And really all it means is you had a temporary, and I mean very temporary, drop in blood flow to your brain. It's self-limited, meaning you wake up on your own. But here's the million-dollar question for every single doctor. Why did it happen?
And that's where we get into the real detective work, what I like to call the fainting mystery. Because, you see, not all faints are created equal. And doctors have to figure out, and they have to do it fast, if this was just a simple whoops moment or the siren of a ticking time bomb in the chest. I mean, look at the two possibilities. On one side, you've got the harmless stuff. Maybe you got a little dehydrated, stood up too fast. No big deal. But on the other side, that faint could be a huge warning sign. We're talking about a hidden heart condition, a life-threatening rhythm problem, or an issue with the actual structure of your heart. Figuring out which column you're in, well, that's one of the most critical jobs in the ER. So, how do these medical detectives start their investigation? Where do they look first? They go straight to the source, the heart's electrical blueprint.
And boom, here's the answer to our first question. The key piece of evidence is the 12-lead electrocardiogram, or ECG. You've probably seen them. It's quick, it's painless, and it gives you this incredible snapshot, like an electrical photograph of what your heart's doing right at that moment.
And just how powerful is this one simple test? Get this, in up to half of all fainting cases, doctors can solve the mystery with just a patient's story, a quick exam, and this one ECG. 50%. That's an absolutely incredible amount of diagnostic power from such a simple, non-invasive tool. So when a doctor is looking at that ECG printout, what are they actually looking for? Well, they're hunting for clues, specific, dangerous patterns that just scream high risk. Okay, our first set of clues is all about an electrical slowdown. It's pretty simple, right? If the heart's electrical system is running too slow, it can't pump enough blood to the brain and poofs, you pass out. This lays it out perfectly. A normal rhythm is just a nice, steady beat. But then you've got these culprits over here. Heart block is literally an electrical traffic jam in the heart. And sinus bradycardia? That's just a way of saying the heart's own natural pacemaker is kind of sleepy on the job. Either one of these can absolutely cause you to faint. Now, on the complete flip side, sometimes the problem isn't that the heart is too slow. It's that it's going way, way too fast. Think of it like a dangerous electrical short circuit that sends the heart into a chaotic race. And these are some of the bad actors. When the heart goes into something like ventricular tachycardia, or VT, the bottom chambers are beating so fast, they're basically just quivering. They can't pump anything. Wolff-Parkinson-White syndrome, or WPW, is caused by an extra electrical pathway, a literal short circuit. And torsades to points, that's a particularly chaotic, twisting rhythm that can be deadly. In every one of these cases, the heart is beating so fast it can't fill with blood between beats, and blood flow to the brain just tanks. All right, our third clue is a little different. Sometimes the ECG doesn't show a problem happening right now. Instead, it reveals a fundamental flaw in the heart's design, its blueprint, making it vulnerable to problems down the road. What's so important to get here is that these are all red flags about the heart's underlying health. A Brugada pattern can unmask a hidden risk for sudden death. Long QT syndrome means the heart takes too long to reset between beats, which is a setup for disaster. And those pathological Q waves, they're like scars, evidence of a past heart attack that maybe you never even knew you had. All of these point to a heart that's predisposed to fainting. And for our last big category of clues, sometimes the ECG shows that the heart's rhythm isn't the primary problem. Instead, the heart itself is under attack from an outside force. Check this out. Your fainting spell could actually be your body's way of telling you you're having a heart attack. That's ischemia, not enough blood flow to the heart muscle. The ECG picks this up as ST segment changes. Or, get this, a huge blood clot in your lungs, a pulmonary embolism. can put so much strain on the right side of your heart that it shows up on the ECG with its own classic pattern.
So after the detectives have looked for all these clues, the slowdowns, the short circuits, the flawed blueprints, and the outside attacks, it's time to deliver a verdict. And this verdict right here determines everything that happens next. And here it is, the bottom line. If the story of what happened sounds pretty innocent and that ECG is totally, completely normal, you're probably low risk. But if even one of those dangerous clues we just talked about shows up, you are immediately, automatically in the high-risk category. There's no middle ground.
And this is exactly why it matters so much. Research is crystal clear on this. An abnormal ECG is one of the single strongest signs that the fainting was caused by the heart. And that kind of syncope, well, it's linked to much, much worse outcomes, including death. This isn't just an interesting finding. It's a life or death warning. So what happens when that ECG comes back high risk? The protocol kicks in immediately. You're getting admitted to the hospital, you're being put on a heart monitor 24/7, and you're scheduled for more specialized tests to figure out exactly what's wrong. That one piece of paper, that one ECG, completely changes your entire course. Which brings us to our final and maybe most important point. Why does this one simple test, this first clue gathered in just a few minutes, matter so much in the grand scheme of things? Because its real magic isn't just in finding the exact diagnosis right away. Its true power is its incredible ability to sort patients, to stratify risk, the second they walk through the hospital door. It makes sure that the sickest patients, the ones in the most danger, get the most care immediately. It's a simple tool that saves lives by pointing resources exactly where they need to go. And that kind of leaves us with one final thought to chew on, doesn't it? In this incredibly complex world of modern medicine, with all of our amazing technology, sometimes the answer to the most urgent question of all, is this person in danger, comes from the simplest, fastest, and oldest clue we have. Thanks for tuning in.